I know. Some of them are still there. But, like, and like with everything that's ended up right now, I don't know how much more there's no, you know, like, I don't know.
She was convicted. She still $14 million they said like people with fraudulent like they was like they would, you know, it will help them. And news, Arizona. Like in
Thanks. Yeah, if I wear a knee, I show that we're wearing a knee. That's like curly hair doesn't do well. Yeah, she can't make it today. She's sick.
This is also Peter Callahan.
Oh, there you go.
I know, I usually, if I'm sitting on a couch, it's usually really why, because I arrive about 30 seconds late.
do you find that you get your questions in that? It doesn't matter. This room is pretty good because you're
Yeah,
close.
I think so. But it's fine, I work, it's about hours of work till yes.
Just soak it all in.
Just don't go to Europe whenever you go to Europe, that's yeah. Or when you're anytime you take a trip, yeah. I feel like that's what's happening. I've been out of state and I come back early. I can't remember anything. I remember like what day or how.
Yeah. And I remember thinking that phone had, oh, it should be like that. She'll take it off. And then I was like, oh, this.
Something else. Hello. I haven't seen you. Oh, am I sorry?
I know I missed the gun one earlier last
Yes, that's what I was thinking of. Why am I here?
Yes, I'm off next week. Yeah. And then I work part of then I'm show.
Yeah. They didn't bring it until back to what was the last time. Or the year before. I don't know. Was it before?
Yeah. Right.
Not a bad day.
Yeah, and it's not quite as intimidating. But
Yeah, and I've had this, I like this one too, this bring off.
I know.
yeah.
I think I don't know.
Good morning, everyone. Thank you for being here today. You're going to hear from Libby Cullum at MNsure. You're going to hear from folks from the Minnesota Medical Association, physicians. You're going to hear from two of our leading experts on health care in the legislature, in Rep. Bierman and Senator Port. Hopefully you're going to hear through our voices the primal scream of Americans saying, what in the hell did you go home for without fixing the health care that you've been promising since 2015? And so we're here today to talk about Congress had a choice. They chose to recess without extending the ACA subsidies. Healthcare costs for working families are going to skyrocket on January 1st. Let me be clear again, that is not speculation, that is not a made-up number, that is not fear-mongering. It's an absolute fact. The lack of leadership out of President Trump and his administration, the lack of any courage amongst members of Congress to deal with the health care situation, continuing to put out misinformation, continuing to dabble in conspiracy theory, but this is real, and we're going to do what we can in Minnesota to make sure we're taking care of our folks. But tens of thousands of Minnesotans, farmers, small business owners, self-employed families who rely on these subsidies are going to see their costs rise dramatically. Rural hospitals and their healthcare systems will be hurt the most. People who still need care are going to go, and they're going to go for uncompensated care at the emergency room, and those are going to fall on hospitals that are already strained to the breaking point. The Democrats in Congress have been sounding the alarm. We were assured that after the Trump shutdown happened, that we would come back, and we were promised by Speaker Johnson that there would be a vote on this. I will thank 4 Republicans had the courage to force that bill to the floor, but they just hammered it out and went home, and they'll go to church on Christmas Eve, I guess. But Congress had that choice. They chose not to. Under no circumstances should any of them have left Washington. And I want to be very clear about this. Tom Emmer and the rest of the delegation have health care provided by us, the taxpayers, by the very people who are going to have their health insurance ripped away and gone up, and we don't hear a single word from them. President Trump has been absent, of course. Ballrooms and pardoning criminals taking his time. The rate increases will take first on January 1st. Consequences will be immediate. Families will face higher premiums. Many will find financial strain. Many will drop health care. I want to thank the legislators here who did the hard work to make health care more affordable, to make us one of the states with the most coverage, to have some of the best care and outcomes. And we put a lot of money into reinsurance. That's basically a drop in the bucket right now because of what they did. So all of the work Minnesota did on our own to lower the cost for people are eaten up by the inaction, the cruelty, and quite honestly, the incompetency of this administration around health care. So I want to thank the folks who are here today, tirelessly working. Folks are still going to get sick. Folks are still going to have babies. Folks are still going to get cancer. Folks are still going to get a broken arm, and they're going to have to get that care. It's just going to be more expensive. It's going to be harder. And at some point in time, it is going to close rural hospitals and is going to make care much more difficult. And again, here we are in 2025. The quote, and I believe he made it in St. Cloud when he was there, healthcare will be easy, I can fix it on day one. He is a damn fool. And everybody who deals with healthcare knows that that is. And I don't understand where the outrage is around this because there's nothing. And the idea for every single person sitting in this room and every single person listening and reading, the idea that he is going to give you the money and you're going to go out there and buy this healthcare is the stupidest assessment of healthcare that I have ever heard out of someone in a position of authority. We've been working on this for decades. Everyone knows that that is absolutely not true. But apparently now, that's the plan. Spoken by someone who I guarantee you has never had to purchase their own healthcare or look at a premium cost or worry about it rising. So it's easy to live your life when somebody else mowing your yard and somebody else is paying for your health care and somebody else is looking at the bills. That's not how life works for folks. So I'll tell you what, this is a guy who's never heard of the word affordability. He's never heard of the word accountability either. And in Minnesota, we'll continue to do what we can. With that, I'm going to turn it over and you'll hear a little bit from MNsure, from Libby Cullum, who will talk a little bit about that, and then we'll get into here some of these legislators and the work that's been being done. Libby?
Thank you, Governor, and good morning. My name is Libby Cullum. I am CEO of MNsure, Minnesota's official health insurance marketplace. I'm here on behalf of the farmers, small business owners, entrepreneurs, gig workers, and early retirees that MNsure serves. We help Minnesotans who don't have access to affordable insurance through an employer. Hardworking individuals and families across the state at all income levels and from all backgrounds come to MNsure for quality, comprehensive coverage that they can use to stay healthy throughout the year. So many of them are concerned about the increasing costs next year. Today, nearly 2/3 of MNsure enrollees receive federal financial help to lower their health insurance costs. Right now, MNsure is in the middle of our open enrollment period. Since November 1st, when we opened our doors, we've helped tens of thousands of Minnesotans find insurance plans which will help them stay healthy throughout the year. Unfortunately, each day we hear from Minnesotans who are confused and anxious because the enhanced tax credits that many of them rely on to afford their coverage have become a political football and will disappear in just 2 weeks. Consumers are reaching out to us at a record-setting rate. Our call center has averaged about 1,000 calls more per day this open enrollment period than last. Our daily website traffic is up 13% compared to a year ago. And the navigators and brokers we partner with to help Minnesotans enroll in health plans have told us that they're booked with appointments from early in the morning until late at night. 90,000 of our enrollees will see higher premiums starting next month because of congressional inaction. About 19,000 of them will lose access to all financial help and pay significantly more in their premiums for next year. Let me give you an example of what it looks like for a family who stands to lose all financial help. In 2025, a married couple in their early 60s living in Bemidji, earning a combined annual income of $85,000, pays less than $500 per month for a bronze plan this year, after tax credits. In 2026, they will no longer be eligible for those tax credits. If they stay in that same plan, they will pay about $1,700 per month next year. That's over $20,000 for the year. And let me be clear, that's not their deductible, that's not their copay when they actually go to use their health insurance. That's the extra cost burden that they will have just to stay covered. Cost increases will hit enrollees over age 55 and people in greater Minnesota particularly hard. Our lowest income enrollees will see some of the largest percentage increases in premium costs. Minnesotans with incomes just above the threshold for Minnesota Care coverage, that's just over $31,000 a year for an individual and a little over $64,000 for a family of 4, will see their premiums spike by 94%, nearly double what they're paying today. On average, we expect premiums to increase about $240 per month next year. And even increased costs close to this average will create challenges for these Minnesotans. Many families will feel the strain and be left wondering whether they should stay enrolled in health insurance that provides access to their doctor or to pay for other critical needs. Should they pay their car bill, pay a bill to fix their car, or pay that premium? Should they pay their electric bill or stay enrolled? It's a terrible position to be in, and we feel for every Minnesotan who has felt the sticker shock as they've looked at their costs for next year. We know that Minnesotans recognize the importance of having health coverage, but federal inaction could mean that insurance for many working families will suddenly be out of reach. Some could decide to go without coverage altogether and choose to roll the dice and hope that they don't get sick or end up in an accident. Unfortunately, when people decide to drop coverage, it can lead to more uncompensated care at our hospitals and an older and sicker risk pool remaining. And that means higher costs for everyone. Minnesota needs a stable market to encourage everyone to be covered, especially young people and soon to be retired folks. The federal government's policy choices have real impacts for Minnesotans. Allowing the enhanced tax credits to expire will have negative effects, not just for Minnesotans' health, but there are also wider-reaching consequences across our healthcare system and our economy. The enhanced tax credits helped Minnesota reach a record low uninsured rate. They have allowed thousands more middle-class and working-class Minnesotans than ever before access and afford health insurance and feel that peace of mind that comes with knowing that you're covered. Without federal action, the health and well-being of thousands of Minnesotans is at risk. Thank you.
Thank you all for being here on this cool day and hearing us out on this very, very important issue. The Trump administration and Republicans in Congress have once again shown they care more about enriching billionaire friends than the health of everyday Americans. This summer, they raided Medicaid to pay a portion of their billionaire tax cuts. And now Speaker Johnson has sent Congress home, as the governor mentioned, for the holidays, while thousands and thousands of Minnesotans watch their insurance premiums skyrocket. Everyone, not just those on Medicaid or the ACA marketplace, will face the consequence of these actions. At a time when our healthcare system across the country needs investment and support, Republicans are defunding healthcare. Yesterday, I visited a federally qualified health center tasked with providing care to many uninsured Minnesotans. I'll tell you, the staff is terrified of the fallout from these disastrous cuts to health care. The word they used to describe what they were preparing for is an avalanche. And I've heard the same stories around the state, firsthand listening sessions we've held across the state, from St. Cloud to Winona to St. Peter and Red Wing, and in my own district, of course. A chorus of Minnesotans who say they don't know what they are going to do. How do you cover an additional $1,000 or $2,000 a month for your health care? And as Libby mentioned, what do you pay? Food or the prescription drugs that you need to take? For too many, the choice will be to go without coverage and put off preventative care treatments. And as was said already, this has a cascading effect. Conditions get worse, and eventually they seek care at an emergency room, who, with less patients covered, will have even more high levels of that uncompensated care they struggle with now. And that is where, as was mentioned, we all pay. The uninsured impact hospital revenues, which impact service lines, which degrades community health, and more uninsured costs get passed on to all of us in the form of higher premiums. We all know the healthcare system is broken. People are tired of navigating through layers of middlemen that drive up costs without improving care. It doesn't have to be this way. Minnesotans understand that healthcare is a necessity, not a luxury, and it should be there when you need it. And we can build a system that puts people first, cuts out middlemen between patients and doctors, and ensures that everyone receives the care they need. There is a different path, and we in Minnesota should blaze it. As was mentioned, Republicans in Congress and this president have no health care plan. But federally, they should cancel the cuts to Medicaid. There is no reason for them. Not for the tax cuts for the wealthy, which will also drive up the national debt. Lower the cost of health care for the ACA for the cost of insurance, affecting 24 million Americans directly and all of us indirectly. We in Minnesota, like every other state, rely on the federal government for health care. Real reform in health care needs to happen, and sometimes states need to make it happen. And we in Minnesota are going to do our part next session. But the cascading cuts and changes at the federal level are going to be something we are going to really have to grapple with. But that's our reality. And so we need to move forward and get people the care they need when they need it, and continue this fight to have our federal government have our backs across the states so that we don't see hospitals closing across the country, which is what is set to happen now. Thank you.
Hello, I'm Senator Lindsay Port. I represent District 55 in Burnsville and Savage. Good morning, everyone. I am also the chair of the Senate Subcommittee on Federal Impacts on Minnesotans and Economic Stability. Over the past few months, I've heard from farmers, doctors, restaurant owners, students, and teachers about the many ways the Trump administration is making life more expensive and more difficult for Minnesotans. Every time Trump and his enablers choose tax cuts for billionaires over the needs of working Americans, people suffer. Nowhere is this clearer than in congressional Republicans' refusal to vote for the Affordable Care Act tax subsidies that keep individuals and small group health insurance affordable for working Americans. Small business owners, gig workers, and farmers who get health insurance through the individual market are seeing their 2026 monthly payments spike by hundreds of dollars. When we held committee hearings on this back in October when rates were released, I met a farmer named Tessa who told us about the fact that she needs her medication, but she currently had at that moment $40 extra in her bank account at the end of the month. She and her husband work 2 jobs and run a farm just to make ends meet, and they have no extra space, none. She said if these subsidies don't come through, it's likely they will lose their farm. It's likely that they will have to just go get a job that can provide health insurance rather than continuing their family tradition and growing sustainable farming in Northfield. Those are the kinds of things that we will lose through this. Costs like that force people to choose between a doctor's appointment or groceries, their prescriptions or childcare, a medical bill or rent. We know what happens next. People put off doctor's appointments and they miss early detections of serious illnesses, letting them progress until they're deadly. Kids don't get their annual checkups and they miss screenings for treatable health conditions. DFLers are doing our part to keep insurance affordable. This year, we dedicated almost $1 billion to stabilize the individual market for individuals, small businesses, and insurers. If we hadn't, individual market premiums would have been 47% higher than the increases now being proposed. But it isn't enough. For almost 90,000 Minnesotans, monthly premiums will increase by 54% on average because Trump and Republicans won't renew that tax credit. We expect 62,000 Minnesotans to drop private coverage because they can't afford it, on top of the 140,000 people who will lose coverage through Medicaid. Americans can have affordable health insurance. All it takes is prioritizing working Americans above billionaire health insurance CEOs, but Trump and Republicans in Congress are not interested in that. I know what my values are. I know how important affordable health insurance is to families across the country. I'm lucky to be working with other leaders in Minnesota who know that keeping people healthy is more important than helping a billionaire buy another yacht. This could not be any more black and white. If congressional Republicans don't get their act together and vote for the tax subsidies that keep these ACA plans affordable, people are going to lose their health insurance and they are going to die. It is easy to make the right choice. That's what Americans need, and that's what Minnesotans are asking for. And now I'll pass it to Dr. Lisa Matson.
Thank you, Senator Port. I'm Dr. Lisa Matson, the current president of the Minnesota Medical Association. We are Minnesota's oldest and largest professional association for physicians in training with more than 10,000 members. I wish I didn't have to be here today, but we are. We're faced with the prospect of thousands of Minnesotans losing their health care coverage because of congressional inaction to improve the affordability of coverage for millions of Americans. If the enhanced premium tax cuts expire, nearly 20,000 Minnesotans will lose all financial assistance. You've heard the staggering numbers on the premium increases that our Minnesotans will face. We know that some of these people will forego care altogether, while others will be forced to choose less comprehensive coverage that will result in them being underinsured. If patients are faced to switch to limited coverage plans, they will face much higher deductibles and out-of-pocket costs, which result in some people being forced to choose between critical medications and food for their families, and that's bad news for all of us. I can't stress enough how important it is for patients to stay ahead of medical ailments and manage chronic conditions. Absent the ability to pay for medications or ongoing treatment, chronic conditions can get worse, which could lead to hospitalization or worse. And it can have an economic impact if it results in time away from work and loss of income. When patients don't have insurance or have inadequate insurance, they often end up using emergency rooms. And believe me, they're not showing up at the ER for preventive medicine. At this point, they are in crisis, when conditions are more complicated or more expensive. We all know early treatment is always cheaper than ER treatment. Many people don't know this, but Medicaid is the primary payer for 63% of people in certified nursing homes. So cuts to Medicaid will make it difficult for these facilities to provide the necessary care for disabled and older adults in their communities. The failure of Congress to extend these enhanced premium tax credits will lead to fewer Minnesotans getting the care they need. That means we will all have a sicker Minnesota. It will mean some ERs and hospitals, particularly in rural areas, will be even more stressed than they are now. The MMA strongly urges Congress to extend these enhanced premium tax credits before they leave Washington, which obviously they have not done. Do this to help preserve coverage for millions of Americans and thousands of Minnesotans. Every person in this state should have affordable access to health insurance coverage. Thank you. I'm going to pass it off to Dr. Matt Hoffman.
I'm Matt Hoffman. I'm a leader in the Doctors Council Union and a family doctor at the Atlanta Vet Sites Clinic. I wanted to take this opportunity to share what it's like on the ground to actually care for patients that can't afford health care. Most of my patients that rely on the ACA tax credits are small business owners, people that work for small businesses. These are people that provide the labor we all rely on to keep our communities, our state, and our country running. The effects of higher insurance premiums may be an abstract issue for the members of Congress that are going home for the holidays, but they're a very real problem for these patients. They're a very real problem for the patients that I'll see next week. If Congress fails to act, what will happen to these patients? Many of them will not be able to afford health insurance at all. They won't be able to see their doctor. They won't be able to get their medication. What will happen to, say, a patient with asthma or COPD who can't afford their inhaler? Maybe they'll get by, but some of them will die. In one of the richest countries in the world, they will suffocate to death, while the medicine they need is sitting on a shelf in a pharmacy down the street. While the millionaire members of Congress are sitting at home taking a long holiday break, many of my patients that rely on ACA tax credits will be working to provide these same millionaire members of Congress the goods and services they take for granted. And how will these working people be repaid in the new year? With higher health insurance premiums and loss of their health care. Working people that rely on ACA tax credits do their part for our country. Congress needs to do its part too. Congress needs to act using any and all tools at their disposal to provide the health care that my patients and all Americans need. Thank you.
Thank you, Dr. Hoffman. Matson, to our to Rep. Bierman, Senator Port. We've held countless roundtables across the state with providers, with hospitals. We put the experts out from Commerce, put the experts out from the Health Department. If there were a little broader lens on this, this is coming on the backs of massive cuts to research into childhood diseases, and it's coming on the backs of absolute deranged pronunciations coming out of health on acetaminophen attachments to autism, circumcisions. You can't make it up. And the folks here, and especially these doctors, have to deliver services. So we've been out talking about this. If I'm not mistaken, I don't believe there has been a single public meeting or town hall by our Republican representatives to address this issue or other countless issues, guns, whatever it may be. certainly we can have multitask. They talk about fraud a lot. They should create a little bit of time here for folks who are actually going to die from the decisions they're making. And so with that, we'll take some on topic and then any off topic.
Ultimately, you don't have any control over what Congress does. Is there anything at the state level, within a session or after the new year, that we can do to,
Yeah, I'll let I'll let some folks come up here. But we do have control over what they do. The clock is ticking towards next November, and folks will remember, but turn to what we can do.
So I think the bottom line is Minnesota cannot make up for federal cuts, and especially the amount of money that are related to the tax credits, the enhanced tax credits that are going away. So I know our colleagues at other state agencies that work with health policy, MNsure, and our state legislators are all looking at policy options, but I just want to be clear that there's really no way for us to make up what the federal government is doing. It's not possible with, our limited resources in the state.
Forgive me if you said this, but do you estimate, when you talk about people facing an impossible choice of, we can't afford this, we might not be able to have health insurance at all. Do you have an estimate of how many people are in that situation and might have to make that choice and not, get health insurance at all next year?
So we know that about 19,000 of our current enrollees will no longer be eligible for these enhanced tax credits. And so those are the folks that we're particularly worried about for, who are going to be making those really, really difficult decisions next year. And they're making those decisions right now during open enrollment on whether or not they feel that they can afford their coverage. The good news is lots of people are finding options through just cheaper plans, but that often comes with a trade-off of less generous coverage. And so, more of our current enrollees are switching plans, and when they're switching plans, they're looking for cheaper options. But the trade-off there is often, a higher deductible when they go to use that coverage, and yeah, the bottom line is we're concerned about the folks who are losing all access to tax credits because they're the ones who are going to be paying full freight for their health insurance.
And if I may have just one quick follow-up, when you talked about the $240 a month on average, I'm assuming that's accounting for those 19,000 plus everybody else. And my understanding is that the 19,000, they're going to see the $25,000 plus a year increases, whereas some others maybe weren't paying anything in premiums at all, but they might see $50 increases. So can you delineate a little bit of just like, is it for the large population an increase that's more palatable, and that 19,000 kind of inflates that number? I don't know if I'm making sense.
You are making sense. So in my remarks, I shared that actually the people who are paying the largest percentage increase are often the folks who are just ineligible for Minnesota Care. So their incomes are around, if you're an individual, about $31,000 per year. A family of four, that's $64,000 a year. That's just above that cutoff for Minnesota's public programs. And those are the folks who are facing cost increases that are almost double what they're paying this year. And so, a lot of those families are in situations where they don't have that extra money in their budgets. So they're going to be making really tough choices about how to cover these extra costs next year.
Does MNsure have any estimates on, I know you mentioned sort of an indirect correlation that might come from people, hospitals having to pay for uncompensated care, that cost being passed down to people who may not even be impacted by this at all. Is there any estimate of how much, when that might happen, how many people that might affect, that sort of thing?
So MNsure doesn't have access to that data. I might phone a friend to my colleague at the Department of Commerce. I'm not sure if that's something you're tracking. If not,
Not specifically. Julia Dreyer, Department of Commerce, we'll see more of that information when we're looking at rates for next year.
Representative Bierman has some report. Do you have any ideas for legislative pushing next session?
I think it's really important to highlight what the folks from MNsure are saying. We can't fill this hole. There's no capacity for the legislature to fill this hole. It is far too much money. Does that mean we're not trying to think of ways? Absolutely not. I know Senator Bierman's committee has been working on this tirelessly. We are talking about, are there tax credits that we can do here? But The reality is this is the loss of a federal partner, and it's ground that we cannot make up on our own.
True enough. As I was at the Federally Qualified Health Center yesterday, I was very glad we had put substantial money into FQHCs last year. That was a significant boost. They needed that beforehand, though. To be seeing, I'm not sure how long that funding will last for them. As far as this coming year, you know, we are in a tied house, so challenging to get things across the finish line. And at this time, especially even without knowing what else might be coming down the pike from the federal government and what else we're going to have to be trying to alleviate and cover in some way, shape, or form. I mean, the implications of H.R. 1 transcend, you know, the state, federal healthcare programs and all the way down to the counties and the cities. And so the funding needs from everyone are great, and they're all going to be coming to the state, and some have already come to me and asked, can we cover this funding gap from the federal government? And it's impossible to say at this point. We have to get into session, but it's also not a budget year, and so it's a policy year. So like every year, you know, we're going to be putting addendums onto our health care, trying to patch this or patch that. But we're also going to be looking at new ways for a healthcare system in Minnesota. And I think that's a big part of the conversation I'm looking forward to having with my colleagues, especially on the other side of the aisle, because we do need significant reforms and change. And so it's going to be an ongoing conversation, and welcome questions.
I would say one on this, because the question is a good one, and that's what we're searching for. But I think Rep. Bierman really hit on this. We're not going to get any help because Republicans are celebrating these moves. They're celebrating the Medicaid cuts. They're celebrating the demise of the ACA. So we could come up, which we have, what they need to do is they need to be talking to their representatives and telling them to vote for the enhanced subsidies and not do the Medicaid cuts. And then that would fix a lot of what we have. But not only are they not going to do that, they are going to celebrate these things happening. And I think that's really important because, again, ample opportunities. We invited them to town halls to come and defend this, to talk about why do you think this is a good idea. And their answer is that they parrot the president and say he hates the ACA. He has no clue how it works, by the way. He has no clue. He doesn't know what a risk corridor is. He doesn't know any of this stuff. It's just that he hates this so that he can rename it. I said we should have just gone ahead and told him to call it Trump Care and keep it the same, and that would have made him happy, because this is just stupid on every front. So it's frustrating to me that you have got real thought leaders in this state. You've got folks that understand how to make this work. My God, we've got a healthcare professional as the leader in the Senate, but what we know is that the counterparts on the other side are not interested.
If Congress were to act, there has been discussion of some extension of the subsidies looped in with some other things maybe that Republicans want. If they were to do it in January or February, can you talk about how that impacts if open enrollment already is closed and people are already seeing increases, is it retroactive? I don't know if you can speak to any of that, but how it would impact if it came after the new year?
Yeah, so we'd have to see exactly what passes, and, assuming it's retroactive to January 1st, we would be able to implement, though a lot of, as you said, our open enrollment period will likely be over by then. Our last day is January 15th. So, we would need to do system updates. We would need to rerun everyone's eligibility to see what they would be eligible for in terms of the new tax credits. And then we would have to look at all of our options on allowing folks to come back into the system who maybe felt that they were priced out for a special enrollment period. So we have that authority as a state marketplace to be able to open up when there are exceptional circumstances, and this certainly would be one. Our first goal will be to just communicate very clearly and directly with consumers. If the federal government does choose to act, we will let folks know what to do and when to do it so that they're very clear on what their options are.
Open enrollment ends January 15th. They're not going to, people aren't going to see the spikes until you're through that, right? Or do they come January 1st?
So folks are signing up right now with the current law in place. And current law is that those tax credits, those enhanced tax credits, sunset at the end of the year. So when they're signing up for their coverage, they're seeing what their increased costs are that will start when they pay that first month's premium due on January 1st.
Well, thank you all. We'll continue to keep you updated on this, this subject. Thank you all for being here. Really grateful. Dr. Huffman, thank you. Appreciate the care. Thank you. We'll talk vaccines specifically. All right. Thank you all. Yeah.
Governor, can you, forgive me, I forget what agency it was, but there was a rule that just came down from the federal government about if they don't, hospitals and healthcare providers provide gender affirming care, that they'll lose Medicaid money.
Yeah.
Can you talk about that? Have you discussed the impact?
Yeah, the team is, and I will get them here on this. Look, this is one of, I don't want to say the number, it's countless numbers. Every night I get an update on this of the threats to our federal money on everything we do. Because look, right now it's very clear. The entire federal government is weaponized against Minnesota. And the issues of things that should be states' rights, states to control, they're threatening us with this. And this is what happens when you have a floundering presidency and it is about those ballrooms and everything else. Now we're back on transgender folks. And these are healthcare providers providing the best guidance to parents and children to get their care. So we're assessing what it means. It's on every front. It's CDLs, it's transportation money, it's money across the board that they have weaponized. So.
The U.S. Attorney's Office suggested fraud could total as much as $9 million, essentially. Do you guys have any evidence to suggest that?
No. Look, let me say on this, and again, we've said it from the beginning. We've been saying it for years as we've worked on this. If you commit fraud, you should go to prison. We need to figure out, and we've done it over time, and there's still work to be done to prevent it in the front end. It's speculating, and I've said since I've stood up here, we certainly know there'll be more arrests. Because I want to tell you a little bit on how this works yesterday, because there was a press conference. We're grateful. The U.S. Attorney's Office, I am grateful for them. Their job is to build cases and prosecute folks and then put them in jail. That's what we do. But what they didn't tell you yesterday is that June I was given the authority to stop payments. The ones that stood up there yesterday and the folks they were talking about on the housing stabilization grants, we stopped payment on them in July and turned the case over to law enforcement to prosecute. They didn't come in here and find that. They didn't come in here and stop payments. They can't do that. But what they didn't tell you is we're partners in this. And they didn't tell you because they don't tell us. And it's been very clear that this is being driven from D.C., and I acknowledge it. Again, you're going to hear this from me. You didn't hear it the other night in a presidential address. This is on my watch. I am accountable for this, and more importantly, I am the one that will fix it. They're not interested in that, so they throw about these numbers. Here's what I think to tell Minnesotans about the numbers. You should be equally outraged about $1 or whatever that number is. But they're using that number without the proof behind it. And our team here could break down what that looks like. They just said the entire program. Well, that is not the case. And this becomes problematic because we're already hearing it and we're very conscious to it. Those programs that the vast majority that are providing incredible services are now being are being put at a disadvantage because we're not able to get them out. So no, we don't have any proof. I don't know if these guys, and I don't know if some of you know Inspector Clark. You can hear the folks from DHS. I'll let them comment a little bit because it's a number that I want to know. Here's what I would say is you're going to see more of these arrests. You're going to see more of these folks happening because many of these are loaded into the system about a year ago. They've been stopped payments. We know who they are and they're going to prison. It's just a matter of building the case because it doesn't happen overnight. But to extrapolate what that number is for sensationalism or to make statements about it, it doesn't really help us. It doesn't get us to where we need. I just need their help to prosecute this. I need their help to help us get a realistic perception on this because the goal here is, by saying the entire thing is wrong, is to pull the very programs that provided this incredible care. That's their ultimate goal. So you'll hear a little on the details.
Sure. John Connolly, Deputy Commissioner and State Medicaid Director at the Department of Human Services. I think a couple of things are important here with respect to the number. We've seen evidence of tens of millions of dollars in fraud to this point. We don't have evidence in hand to suggest that we have $9 billion in fraud in these benefits over the last 7 years. And if there is evidence, we need it so that we can stop payment. That's a very alarming number. And so if there is evidence, credible allegations of fraud, we need that information to take action now. I think that's the first thing to say. A couple of other things that are important about these services and the figures out there. So of the 18 billion, 6 billion ran through a managed care organization. So that's one level of vetting that they are charged with doing in their contracts with us. In addition, 10 billion of that 18 billion is subject to electronic visit verification. And that basically means that a worker that goes to provide services in someone's home is basically indicating with a timestamp when they arrived, when they left, what service they provided, who they are, and who received the service. So that's another level of vetting. The third is that $11 billion of the 18 was authorized by a county case manager. So that means that care was authorized according to clinical need, an assessment, a care plan, and then authorized again in the dollar amounts by a county case manager. So we are looking at all of those things to be sure that our checks and balances are working, certainly in partnership with those folks that are part of our systems. But I think that is just an important piece of context. And then the last thing I'll say, there's been suggestion also that we are suddenly withholding payment or stopping payment. We have a 2-week compassionate transition period that we give to providers and county case managers to work on transitions of care, to make sure that folks who are impacted by a payment withhold applied to a provider have the ability to transition to another service provider as needed. So there are intentional actions in place to support folks who may be impacted by a provider with a withhold that's applied to them.
Yesterday, we heard from them saying, yesterday we heard from federal prosecutors who are finding fake companies that are out there. Not just tweaking the hours of care, but just totally fake companies out there. That's all they're saying. Is that what you're seeing?
I might invite Inspector General James Clark to talk about that.
James Clark, Inspector General at the Department of Human Services. Unfortunately, we are seeing greedy people and businesses exploiting our Medicaid program, right? $1 of fraud is too much. So I haven't seen evidence of billions or $9 billion of fraud, but again, any amount of fraud is too much. We have been moving aggressively at the Department of Human Services more than ever to suspend payments when we see evidence of fraud and refer criminals to law enforcement. If there is evidence of Medicaid fraud, the state should be given that information so DHS can slam the door on these people and businesses that are engaging in fraud. I have a very unique role in state government. I work at the Department of Human Services. I can shut off money to people and businesses where there is evidence of fraud. I previously sent letters to the U.S. Attorney's Office asking them to share evidence of the fraud, and I hope we meet soon. But to answer your question, yes, unfortunately, greedy people and businesses have learned how to exploit our programs and are trying to steal from us.
Have you responded to your questions asking to show evidence?
So far, I haven't received any evidence or information to support the billions or $9 billion information from federal law enforcement. But again, I want to collaborate. I want to partner with law enforcement. That's how this system should work. We investigate, we suspend payments, we refer cases to law enforcement, and to the extent there is information about massive fraud in our programs, billions or $9 billion worth of fraud, I desperately want to see that evidence. I want to partner with law enforcement. I want to work on real solutions to these problems.
Well, I mean, to be clear, though, I mean, Joe Thompson was saying that he, by looking at it, he thinks there could be, he didn't suggest that there in fact is. He's saying it could be as much as that.
Is that called speculation?
Well, but his reasoning was based on looking at reviews of billing in previous cases, he sees more red flags than he sees legitimate providers, and you guys have seen that on your end too, right? People overbilling, there being some suspicious payments there. So is it wrong for him to look at that and say, I'm seeing some of the red flags we've seen in other cases, if that's where he's coming from on this point?
I wouldn't say it's wrong. I mean, we do the same thing at the Department of Human Services. We look at billing data, we look for red flags. What I'm saying is I haven't seen any evidence or information to suggest that there's $9 billion worth of Medicaid fraud that has happened in the state of Minnesota.
Do you have a number as the Inspector General?
John, do you want to take that over?
At this point, like I said, the evidence that we have indicates tens of millions of dollars in fraud. We know that investigations are not done. As the governor said, we are still working hard to get ahead of the fraud, to prevent fraud and also investigate fraud that may be in the system. So there isn't a final number at this point, but we don't have evidence to suggest that level of fraud or a $9 billion number. Like I said, at the outcome of legal proceedings, tens of millions is really the number we have at this moment.
About the ICS program, is that what you're seeing in the tips you turn over to outside law enforcement? Is the ICS program where you're seeing a lot of these problems?
Eric has the last question. Unfortunately, we have suspended payments to ICS providers. Information from investigation shows that certain providers are billing us for services that they are not providing. And when we receive that information and when our investigations confirm that information, again, we suspend payments, we shut off the money, and we refer to law enforcement.
Governor, can I just clarify something that you
Sure.
said earlier? You said, I'm accountable. Is that you taking blame for this? I just want to make sure that I'm clear on that. And if not, who or what?
Look, who's ever in charge, and I said, unlike the president, I'm the governor now. Whether these programs happened before we got here or afterwards, it doesn't matter. We're here now. We're the ones fixing it. You have my guarantee on this is that I certainly will have this thing fixed, and you see that we're on the front end of it. That's how this works. And so would I have wanted to stop this? Would I have gone out? You know, if you think the governor goes out and checks somebody on Medicaid and that they were there, no, but that's somebody in government needed to do that. And if they didn't do that, or if there were loopholes in this, and what we found is these are poorly written and it left openings, and the goal was to get the money out. We'll fix that. But yeah, I'll take accountability for it. But what you're seeing here is you're seeing a weaponization. We'll continue to fix it. They're going to continue to come up with numbers that don't have it there, and it's sensationalized. I don't expect anything different from this administration. But the thing that I think that folks need to recognize, and I think they do, as governor of Minnesota, I'm working on the healthcare side of things. We're working on plowing the roads. We're working on making sure we're implementing the best paid family medical leave program. And look, the Republicans think they're going to, but that's it. You don't ask to be governor of Minnesota just complaining about a problem that you did absolutely nothing to. And I will highlight at this point in time, if there are members of the legislature that have credible concerns, we have independent folks. We have numerous folks who you could get this to, but as James said on this, it took 6 months to arrest these people. We stopped it immediately once we had that authority. And so that's happening across the board. We're going to, I think, at the end of the day, and even the CMS folks who are now showing up, unannounced, unprecedented, showing up and doing their inspections are acknowledging that Minnesota is, at this point in time, probably tighter than any other state. And those are good things that we're using the ability to try and fight this. But yeah, you'll hear something from me that you don't hear from them. Yes, I accept responsibility. I'll expect responsibility to fix it. I again thank the Department of Justice, the Attorney General, for doing the things necessary. I would also ask them to multitask. You've got some files you need to get out in D.C. You got some other stuff you can work on. You can help us on fentanyl. You can make sure that our police are funded where we're getting cutted. Our anti-terrorism dollars were taken away. So the big picture here is the focus is this, yeah, and this is terrible. And as James said, $1 too many. But I'm not going to shy away from the great accomplishments we've made here, the things we've done, our ability to fix this, and I'll take accountability for it. I expect to get accountability from the Republicans to help us out and fix this. So if you're setting on information, you're going to be part of the investigation very quickly if you're not helping us. You need to get these things forward. I don't care. We have an independent. Give it to Tim O'Malley. He's there so you can do that. If you're saying you don't trust law enforcement, I don't know why. You don't trust BCA. I don't know why you're not backing our folks in uniform who are fighting this. These are the folks who did all the work. They did all the research. They said, yeah, this is the case. We stopped this. They're not getting money, but these guys are criminals. Here you go, Department of Justice, prosecute. And then they're being told to turn around and, I mean, how often do you think the President of the United States comments on individual cases of Medicaid fraud? For God's sakes, we got a senator from Florida who is still in the United States Senate and was credibly accused of Medicaid fraud. So the one thing I think Minnesotans need to know is that you're going to see more of these people going to jail. You're going to know that a lot of these people already know they're going to jail because they've been stopped in this. As you heard, the compassionate approach that we take to this is we're not dropping you off immediately for these providers and getting folks to where they need to go. This is about solving the problem. Nobody in the legislature on the Republican side is interested in solving this. My God, it would be the worst thing in the world for them if this is solved like we're doing it here early this year, because then what are they going to run on? Cutting your health care, cutting children's meals, raising taxes for the middle class, standing with war criminals, not having the courage to stand up when the President of the United States calls your neighbors garbage and this state a hellhole. They got nothing to run on except complain about this. So you complain at me, you bring it at me, but I'll have it fixed, and then we'll see how you talk about it. So grateful to all of you, grateful to the folks who are here, and we'll keep on it. Thank you.